I was ready to kill myself. I've tried it a few times, it's never worked. And when I finally got referred, I was crying like a baby. Then Robert rang me and we spoke over the phone because I was just, really down. And that was the first time I spoke to him, and then he came to see me. And then we started talking, and slowly the crying sort of eased off.
So this is a service that primarily works with people with a complex set of symptoms, especially difficulties with their physical health, but also with mental and emotional difficulties and interpersonal challenges. So a lot of the patients we see will have what we perhaps call persistent physical symptoms, which is often a set of physical symptoms. Sometimes there is no clear cause that is found on x-rays, on investigations, but the patient nevertheless continues to suffer.
It's just waiting to die. You sat there, you're eating, you're sleeping, take medication, then you get up the next day and it all starts again. It's like Groundhog Day. That's what it was like. I think that would be like now if I'd not been able to speak to somebody about things.
The people that we work with are high users of healthcare, and that can be tending the GP quite often in terms of their physical health problems or their mental health problems, and it can also be people attending A&E in a crisis where they just kind of feel completely overwhelmed and feel like they can't manage their distress or their mental health difficulties.
We base our work with patients on a relational approach. That means we strive to develop a positive therapeutic alliance or a relationship or a working relationship between the patient and their liaison practitioner, the professional who works with them. This relationship then becomes the basis from which we develop strategies and ways that helps the patient to cope with their difficulties, to improve their quality of life.
I've had therapy before. I thought my therapist was struggling with the things I had to tell her. And when it got too hard for me to start again talking about it, I'd left it. With Robert, I didn't find that. He just listens, and I didn't feel embarrassed about it. It's the first time I've ever talked to anybody about all these things. I felt comfortable to talk to him about it. And we worked through the problems it was like peeling layers. I know that's a cliche, but that's how it is. It's like going backward to where I started. And it was hard.
Through the relationship that we have with patients, we're able to help them explore the trauma that they've experienced in the past in a safe environment, so that they can look at how they can manage that trauma, the thoughts and feelings that trauma has given them, in a more positive way, and perhaps look to be able to do much more in the future, get their lives back on track. That can mean learning to manage their emotions better, learning to manage their painful thoughts in a much better way, perhaps to look at their substance misuse. Those kind of interventions that are linked, their coping skills that are linked to the kind of trauma that they've experienced in the past, is something that we support people in trying to achieve.
For us, for every patient that we've referred that's engaged successfully with the service, we've seen a dramatic number of them needing to come in to see us here. So as a GP, we see them far less. When we do see them, it's much more appropriate. It's usually for a health-related matter. I find that when they come in, they're able to express themselves better because they understand what it is they need to try and communicate. We've also found it's had a really significant impact on the number of referrals and attendances they have in the hospital, which we know, there's already significant pressure on. So less attendances to A&E, less needs to be admitted, and less referrals and outpatient appointments. We've talked about prescribing, so actually the number of medications that they're on can reduce in some cases really quite dramatically. And often these are medications that have lots of side effects. So again, that benefit on their health is really positive. And I think lastly, it's their wider health and well-being that we see a real benefit from. So for the first time, they engage with services so that you're resolving issues like employment and housing and getting people back into work, or they might start volunteering again. They start looking after themselves better, so diet and exercise improves, and that all has a really positive impact on their weight. I can think of one patient who came in real crisis but was diabetic and not taking their medication, was on insulin, and actually working with the service has really helped them to control not just their physical well-being but also their mental well-being, and really kind of getting back into society in a way they hadn't done before.
I think when we're working with people who've had a lot of difficulties engaging in other services, it's key really to have the time to work with them, opening up about a lot of difficult issues that they've not been able to speak about for a long time. A lot of them feel that they don't deserve help or they don't deserve to get better. So it may take up to 12 months to feel that we are actually getting somewhere.
Trying to get to what my real problem was, it took a while. And then it's like ripping something open and then trying to put it back together like Humpty Dumpty. It takes a while.
In our neighbourhood we have MDT, so multidisciplinary team meetings every 2 weeks. So that's where GPs, district nurses, social workers and our voluntary sector come together, and we discuss really complex cases. And we found it really helpful to discuss the sorts of patients who are under the psychological medicine service, because quite often, as well as complex medical and psychological problems, they often have really complex social problems. There's often really significant safeguarding issues. They often are turning up at the hospital, often in crisis. So actually we found that working in that collaborative way, discussing these patients as a team and coming up with plans together, that's been really helpful in managing them, so that everyone's on the same page when you're trying to manage these patients.
Sometimes I get into a dark place, it's even now, but I know how to get out of it now.
These services offer people the chance to rebuild their lives. Without them, people will die. It's as simple as that. Our lives have been just completely altered in the space of 6 months. That is a dramatic change from someone that had given up, to someone that didn't see a future, to someone planning their future. And the effect it has on everyone around her, on me, on the children, on everybody that knows her and looks at her and goes, wow, how well you look these days. And it's like, you really can't put a price on it.